In this video, we are going to tell you about the top 10 most prepared countries to respond to COVID-19 in 2020. The Global Health Index has listed down some of the countries with the best healthcare systems worldwide and prepared to deal with the recent pandemic. However, 2 years back, the World Health Organization director has already addressed the people about this pandemic. He informed those who attended the World Government Summit conference that the world is certainly not prepared for it. Today, the Director General's speech is considered right all along. In addition, the outbreak of coronavirus has gripped the world. This has caused millions of deaths and several affected. The world is not the same anymore. Unfortunately, the current outbreak has shown its reality. Moreover, the big million-dollar question is, how much are we ready for a global pandemic? According to the Global Health Security Index, the report prepared by the Johns Hopkins Center for Health Security, the Economist Intelligence Unit, and the Nuclear Threat Initiative, has revealed 195 countries studied. The study finds that national health security is very low or weak. The countries are not ready for such a global pandemic. In dealing with pandemics and preventing measures, detection, and response to the virus outbreak, the report shows vulnerability. The overall Global Health Index score in 2019 was 40.2, which is out of 100. In wealthy countries that have one of the best healthcare systems, the average score was 51.9 out of 100. Also, according to NTI co-chair and CEO Ernest J. Moniz, results are alarming. All countries at all income levels have major gaps in their capabilities. They aren't sufficiently investing in biological preparedness. He further added, the bottom line is that global biological risks are growing. In many cases, faster than health systems, security, science, and governments can keep up. We need to ensure that all countries are prepared to respond to these risks. Whether naturally occurring, intentional, or accidental, outbreaks in any country pose risks to global health, international security, and the worldwide economy, shared by Center for Health Security Director Tom Inglesby. He further continued, we hope this index will help countries identify gaps, build preparedness and best practices, and track progress over time. In addition, NTI co-chair Sam Nunn also stated, this index is a powerful tool for citizens and civil society to hold their government officials accountable for health preparedness. The Global Health Index has analyzed different countries' data. These are based on 6 different categories, 140 questions, and 34 indicators. The report has deliberately utilized public data for the survey. The countries are assessed based on their scoring from 0 to 100. A full score of 100 represents full preparation to deal with any biological catastrophe. Number 10. Finland. Finally, Finland has secured its place in the top 10. They have one of the most advanced health protocols to deal with the biological catastrophe. The country secured the 10th position with a score of 68.7. Finland is last in our list of the top 10 most prepared countries to respond to COVID-19 in 2020. Number 9. South Korea. South Korea is another country to be on the list of most prepared. According to the Guy report, the government has secured a 9th position on the chart with a score of 70.2. South Korea is second last in our list of top 10 countries prepared to fight with COVID-19. Number 8. Denmark. Denmark has secured the 8th position with a score of 70.4 for dealing with any kind of global health emergency. Number 7. Sweden. Sweden has scored 72.1 on the Guy chart of the most prepared countries, with the 7th position. Number 6. Thailand. Surprisingly, Thailand has only secured the 6th position with a score of 73.2. Number 5. Canada. Canada has secured the 5th position on the GAI report of the most prepared countries with 75.3. Number 4. Australia. There is a point difference between Australia and the Netherlands in the Global Health Index list of prepared countries. It has just brought Australia on the 4th with a score of 75.5. Number 3. Netherlands. The Netherlands has scored 3rd on the chart, with the highest preparedness in dealing with health emergencies, with a score of 75.6. Netherlands is 3rd in our list of top 10 countries prepared to fight with COVID-19. It is because of its high health emergency score. Number 2. United Kingdom, UK. The United Kingdom has scored 2nd on the scale. The country is the most prepared after the USA with a score of 77.9. United Kingdom is 2nd in our list of top 10 countries prepared to fight COVID-19. Number 1. United States of America, USA. The ratio shows the United States of America, USA, as the most prepared country of them all. The country has scored the highest on the scale, 83.5 out of 100. USA tops our list of top 10 most prepared countries to act against COVID-19 in 2020. The countries mentioned above are under the list of most prepared to deal with the pandemic. Still, most countries that are almost least prepared to deal with any pandemic are the countries of Africa. Not only that, North Korea has the least score with 17.5. This is from the GAI Preparedness Index list in dealing with any kind of global health emergency. Somalia is in the 2nd least with a score of 16.6. This includes Equatorial Guinea is at the bottom with a score of 16.2. However, the country from where the whole ruckus of the global pandemic of COVID-19 started is resting at 51st place with a score of 48.2. The Global Health Index's overall average score of 40.2 is very low, which increases 51.9 for wealthy nations. Now, how can we deal with the situation at hand? The world and all the governments need to join hands. All the governments need to be committed and take measures to deal with the health security risks. All these can be done by assessing the healthy security capacity. Furthermore, all the countries need to be measured on daily basis. The results need to be accurate and transparent enough to provide reasonable solutions. The international community, including wealthy nations and the world forums, are needed. They must focus on and tackle health-related threats with the right response. The world is surely not ready to deal with any kind of biological pandemic or epidemic. The countries need to unite and work together to overcome the COVID-19 threats for the years to come.